Hi, this is lesson 7 on the hip joint. The hip joint is the joint where your legs meet your pelvis, right? And it's a ball and socket joint. It's got a lot of movability. No, you can't do exactly like this, but it's got a lot of range of motion to it. What does it mean to say that it's a ball and socket joint? Well, if this was my leg, it comes up and attaches into my pelvis with the ball. So that's the ball part of the ball and socket joint. The acetabulum is the socket. That's on the pelvis where the leg fits in. Now, not all hip joints are the same. So you might be born with one that is shallower socket and you'll have greater range. Or you might have a deeper socket and you'll have a little less range. Or you could have rotation to the thigh bone, or the neck might be of different length. Those structural influences that you're born with will all influence your ability to turn out. So there is a structural limit to your rotation. Now, average rotation is 45 degrees of external rotation and 45 degrees of internal rotation. And we're not going to be exploring your turnout right now, but I just want you to know that how the actual joint is designed, and that's from your genetics, is going to have a bearing on what happens. Okay, the other thing I want to say about the hip joint is there's a ligament that goes right from the middle of the ball into the socket, and that helps to keep the hip joint in the center of the socket, which is where we want it to be, because if you're pushing it around there by forcing your turnout, you can start to tear at some of these ligaments and cartilage, and that's where we get labral tears and or injuries to the hip joint. So it's designed to stay in the socket, and we want to honor that. We don't want to stretch our ligaments. They're inelastic, and that's what they should be. Their job is to tie the bone to another bone, okay? All right, let's take a moment now. You might want to go to your student activity sheet and label the different parts of the hip joint. Then let's do an exploration so that you can get more familiar with how it feels to have movement just in the hip joint itself. All right, let's start by lying down on the ground and grab your TheraBand if you have it. You want to wrap it around one of your legs and place both feet on the ground, right? Nice and easy. Start by trying to lift the leg up by using the TheraBand or the towel or the other band, whatever you have. It actually feels really nice and free to move in the joint like that. Then what I want you to try to do is to simply move easily the leg using the TheraBand to support the weight. And this again feels really luscious. Now let's say you don't have a TheraBand. You could use your hands or have someone else hold your knee and gently move it around in the joint. You're working to use as little effort as possible as you move your thigh bone in the hip joint. Of course, we want to do both sides. It's always interesting to me to compare and contrast what the two sides of my body feel like. But this actually does feel quite luscious, quite lovely to just let the bone move easily, almost like stirring the soup, right? You might think of with your thigh bone. After doing it with some assistance, I want you to try doing those same motions again with as little activity as possible. Try to make it very easy. You start by drawing your heel towards your buttock and just letting the thigh flex, and then seeing and comparing and contrasting what that feels like when you're not using your hand or the thigh bone. Don't go into any discomfort or pain. Just be curious. Like I noticed there's a point that if I push, I can feel a little pinchy there. And I feel, right in here, like I get caught, so that's interesting. I might need to do some more stretching to the front of my hip. But I'm just making this motion really smooth and easy. There shouldn't be any clunking, no clicking, no popping. That would be all indicators that we've got some perhaps resistance at the hip joint. But I want you to just notice and see how easily and freely actually the leg moves in the hip joint. Good. Like I said before, we'll work on some of the muscular issues for rotation and hip joint freedom in level 2. On to lesson 8.